This session's going to be slightly different. So we're going to begin with some presentations on physical health, which is one of our priority areas for our quality improvement work. We're then going to talk to some of the service users who have been part of a quality improvement project and have had the benefits of that. We're then going to have a physical health session, physical activity session, with a surprise facilitator. And then we're going to have a panel discussion where you guys can pose some questions to our panel and they'll provide you with some answers. So I'm now going to hand over to Dr. Kevin Cleary, our medical director.
Okay, thank you very much, Emma. So, why have we made physical health care a priority for us as an organisation? We know that if you have a severe mental illness, your life expectancy is reduced by about 20 years over someone compared who's living in the general population. This is a tragedy. It's something that we've known for a long, long time, but it's also something which we haven't effectively been able to do anything about. Why does this happen? It's partly because of lifestyle. So if you have a severe mental illness, you're more likely to smoke, and obviously that has a very significant impact upon your health. Your nutrition is more likely to be poor. You're more likely to develop diabetes, and in some parts of our organisation, our patients have type 2 diabetes rate of about 30%, and that's really, really high. We've done a number of things recently to sort of look at how we can change things. So we've developed a trust-wide physical health care collaborative. Our staff have come together from all over the organisation to think about how we can improve the health care of our patients, the physical health of our patients, service users. And we've done a number of things here. As you can see, we looked at equipment assessment and monitoring. You have to do a whole load of sort of complex things really to sort of make an effective difference to what's happening. One of the first teams to do this work was the AOS team, the Assertive Outreach team in Hackney. One of the things that which you have been bad at doing is reliably, 100% of the time, monitoring the physical health of our patients. So one of the things they did was get one of these pods, and these are all in our CMHTs now. So service users, patients can take part in monitoring their own healthcare. So they come in whilst you're waiting, you can stand on that machine and it measures your pulse, your weight, your blood pressure, and calculates your BMI. Having done this successfully, started to roll this out across the organisation. And then work on health promotion. Again, it's something which actually I think secondary healthcare services, mental health services have been quite poor at. So getting people to stop smoking, physical activity, communication, getting people supported formally and informally, and educating people. And now we're going to hear a little bit more about a specific bit of work that's been undertaken in Newham. So, Steve.
Good morning. Here in Newham, we've been running a Healthy Lifestyle for Longer Living project, and that's to improve the physical well-being for those connected to Newham Centre for Mental Health. Over the last 6 months, we've been focusing our efforts on Sapphire Ward, and we've been the aim of having 50% of our service users to achieve 30 minutes of physical activity per day, as this is considered the most effective way of managing and improving your health. We've been using sticker charts to monitor the patient activity levels. And as you can see from our data collection, initially we had a lot of enthusiasm and activity going ahead. And this has now plateaued, so we've got some realistic baseline data. So we've got 11%, just around 11% of our service users doing regular exercise. And now we're in a position for our multidisciplinary team to start considering some change ideas to increase them activity levels. We have had some success with our Healthy Living project. With the help of our dietitian, we've also completely changed the catering menu, so the meals that we serve are far more balanced and nutritious. And now we're actually looking to reduce the amount of sugar and biscuits that's actually served on our wards outside of meal times in collaboration with our service users. On Opal Ward, we've been looking at the health and well-being of staff, and we've been trying to encourage them to actually do more exercise and get the 30 minutes of activity, and also see whether this has any effect on patient outcomes. We've also been running our well-being games. So we've got the games going ahead this year again on the 6th of June at the Queen Elizabeth Olympic Park. This is a yearly event we have where staff, service users, friends and families can come and participate in a day of sport and events. This is now in its 4th year. We did start this at Newham Leisure Centre when we did the London 2012 Olympic Games, and that was in celebration of that. So you're welcome to come and join us. Thank you.
Thank you, Kevin. And thank you, Steve. Okay, so we're now going to move on to the next part. Sorry, Steve. And look at the final part of the driver diagram, which is service user and carer engagement. And we have invited some of the service users and staff from the Bridge Club to come and speak to us briefly. So if I can invite Sian, Laura, Dane and Alex to the stage, please. So the Bridge Club was set up in February 2015, and this is a QI project that aims to improve social inclusion, and it runs different activities where service users from Wolfson House or who've been discharged from Wolfson House can come together, form a community, engage in different activities for both their mental health and their physical health. And these activities include football, boxercise, a community cafe session, and they all come together and create a community. I'm just going to hand over to Sian, who's going to tell you a bit more about it.
Yeah, the Bridge Club was, well, it came from talking to service users, really, who'd been discharged and who were really struggling with feeling isolated in the community once they were discharged from hospital. And all of the activities that we've done since we started a year ago, so we run a fortnightly cafe. We have fortnightly football sessions, which are run by Sam and Kamal. Myself, Diana and Laura run the cafe. And we have weekly boxing sessions, which we kind of all take turns with. But in addition to that, we're trying to kind of build a community and a sense of belonging and support people to build and maintain friendships. And we've done some sort of quite daring things, I suppose. For example, in August last year, I think nothing like this had ever been done in forensic services before. But we took our guys to the music festival, the free music festival in Newham, and we were out till midnight. I don't think people had ever been out beyond 8 o'clock. And we were all rocking it to Maxi Priest and Aswad and Janet Kay, and everybody had a fantastic evening. We also had a Christmas do. Our guys have got lots of ideas about things that they want to do. What we need is funding and capacity in terms of staff. But I think also what's really helped it to work is the guys' enthusiasm. We're constantly being asked by service users, can I come along to this event? So we don't have to do any recruiting, they come to us. And I think that's why every single staff member in the Bridge Club feels totally dedicated to this project.
Thank you. And I wanted to just ask you guys what you think of the Bridge Club as well. So what do you think of the Bridge Club? How have you found it?
Yeah, I think it's very positive because basically you can, well, it's good for your health and your fitness and stuff like that. And at the same time, it's fun. So we're doing boxing, same time we're doing football as well during the week. So yeah, it's a good turnout, yeah.
And what about yourself? What activities do you particularly enjoy doing?
Enjoying the football is quite fun. We get together from all the patients from the hospital, patients that are in the community, they all get together. And also we get together not just for the football, but also the boxing. And it's been good, it's been really good. I advise everybody to, come and have a look up, just pop in and say hello or anything like that.
Great, thank you guys. And here's just some more feedback that we have received about Bridge Club. So people have found it really good for their health, for their fitness. It's really good to be with their friends. And they've made a thank you for everyone for sponsoring the Bridge Club. So thank you guys for coming along today. So as the guys mentioned, they do boxercise. They do boxercise every Thursday evening. And we have invited their coach to come and run a boxercise session for you guys. So their coach is James Cook, who is a former European and British middle superweight champion. I hope I've got that the right way around. He hung up his gloves in 1994 and has been working with the community. So he's also a champion of his community. He's been working with young people and people with mental health conditions to try and increase fitness and raise awareness and create a space where people can go. And in 2007, he was awarded an MBE. So I'd like to invite James to the stage. James is going to briefly tell you about the boxercise that he does.
Thank you. Is it morning still? Good morning. See, I've been here a long time this morning. You want to know about this bandage? I tell everybody why I wear these bandages. They hardly come off my hand. I've got 4 daughters. Yeah, and since I retire, daughters don't come run to regular. The boys them don't come run to regular. So my daughters them is pretty upset. You know, just in case, right? Guys, I've been doing boxing from the age of 10, to be quite honest, and so I've been doing it for about 47 years. So that make me what? 57, I like you. Well done. God damn, 57. I even like you better now. You need to come up here and do some boxercise, okay? And fitness, like I said, I know 2 things: beating up boyfriend and getting fit. I've been fit, you know. Fitness is the key of life, you know. Like I said, I don't too often listen to what government say or what they do, but you know what? Government is speaking about fitness being healthy, yeah? What I like is when somebody's strong enough, you know, to get up, run a management team and say, this is what we want. Like schools is not doing boxing. East London phoned me up and they say, James, can you come and do some stuff for us? Yeah, I've done it, so they employ me more, which I like. You know, I've got grandkids now, so, you know what I mean, it's all good, you know? So, you know, but fitness, like I said, fitness is the key of life, you know? Your heart, your lungs, you feel fit, you're good to go, you know? We're gonna do some stuff, you know? The way I wanna do it is, if nobody volunteered to come up and do this stuff or help us out, I will let, just like that bloke from Leicester City, make you all stand up and do some stuff. I'm an Arsenal fan, so this is one of the reasons why I put this bandage on, just in case I wanna have to make a comeback today with him, you know? So, yeah, so does anybody want to come up and see what it takes to punch for 3 minutes non-stop, 2 minutes non-stop, or 1 minute non-stop? It's up to you, you tell me. Young lady.
We'll give you time to think about
Young lady.
because we're just going to show you a video quickly first. So we'll give you time to think about it whilst you watch the video of James in action. If nobody volunteers, you're all going to do it.
Boxing is really good, but hard at the same time as well. It's not easy. It's not easy at all, so. But it's good fun at the same time as well. I mean, you learn the skills and stuff like that. 1, 2, 3, 4, 5, 6, 7, 8. Let's go. 1. Keep them the same way. 2. Do it. 3, 4, 5. Beautiful. Change leg, change arm. 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Nice. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We've been coming since
enjoy the actual physical activity, plus be around friends and like get involved with friends. New stuff really like.
Just like to say one thing, thanks for people who are sponsoring the Bridge Club.
Hey, thanks Sean as well.
Thanks Sean over here.
And Laura and Hannah.
Laura. All the people who help run it.
I've got to say that, sorry.
And thank you for James Cock for taking us on and and Cole, mate, you showed not bad for
Thanks to the coach as well, he's over there relaxing. The coach as well, yeah?
Cheers, coach.
Yeah. Nice.
Right, so like I says, about fitness, does anybody want to stand up? Try punching for 3 minutes, 2 minutes, 1 minute. The choice is yours, yeah? Come on in. It's all about the lungs and the heart, okay? Anybody else? Young lady who said I was 57. Because now, when I go out and people say, how old are you? I says, I'm 50 little bit. Right, anybody else? What to all these muscles I see at the back? The choice is yours. We can think about it. I said, somebody will come up or you all will get up and do it. Okay? There you go, sir. Thank you very much.
So what do we do?
What we're going to do, right? You ever done boxing before? Okay, right. Right, punches, okay? I'll show you about punches because I still got to keep reflexing now because, you know what I mean? When we punch, okay, we're going to go across. This is the reason why reggae music come into it, yeah? Okay, because it give you that. Yeah, okay, so we punch in, we're going across like this, yeah? Okay? Right, okay. So we're going to, with Professor Gunn, who's got the clock. Where is he? There you go, sir. What are you doing at the back there? You got the timing, man. Yeah, we're gonna go 1 minute, yeah? All right, okay. I'll go with you, yeah? For 1 minute non-stop, yeah? Where to go? Yeah. Come on, man. Go quicker than that, man. There you go. Yep. No, okay, keep going. Sorry, said not yet. Don't die on me. Don't die on me. Don't die on me. Don't die on me. Come on, keep going, come on. You're dying, man, you're dying. There you go, well done. How you feel? You see what happened? See?
That's a good warm-up.
There you go. See, it's a good. See that heart and lungs? Get going. Thank you very much, sir. Listen, where do you live?
Not far from here.
Okay, there's a hospital run by you. If you're feeling pain tonight and feeling, you know what I mean, just go on there for a quick check. Well done. So, guys, like I say, whatever you do, no matter how you do it, listen, even if you just listen, you don't have to go to the gym to do something, yeah? Do it in your bedroom, in your kitchen. You're doing something, yeah? Trust me. And you will live to see 57. And a little bit more, yeah? Right. Thanks, guys.
Thank you to James. So we also have some physical health work taking place across the world. So I'm now going to introduce Olivia Carmichael, who's going to talk a bit about Beauty Beaker Link.
Thank you. And yes, thank you for inviting us to talk a little bit about our global health programs as well as our programs in East London. So I've been coordinating the link for the last 3 years, but last year we celebrated our 10-year anniversary. And so we have a partnership with Beauty Beaker Hospital in Kampala, which is the national mental health referral hospital in Uganda. And we still have many projects going on today. We have 3 large funded projects by DFID. And like the East London activity, we wanted to support some physical health training in Uganda. People who have serious mental health problems suffer with serious physical health problems. The rates are higher in Uganda as well as in the UK. So we got together with the Ugandan Diaspora Foundation, and we've commissioned a couple of projects. One which was led by Kate Corlett and Rachel Kemp from within the Trust, offering some physical health training to the staff at the hospital, and looking at non-communicable diseases which are on the rise in Uganda. And we also had a project to start a football initiative. So we've partnered with professional teams in Uganda to run football schemes with the staff and the service users at the hospital. So not only kind of raising healthy awareness and around physical health, but also doing something to work on the stigma around mental health in Uganda. So I just wanted to highlight that really and talk about how not only are we having international recognition for the projects going on in East London, but also that we're doing projects internationally as well. So thank you.
Okay, so the first part of the session, we've looked at the physical health work we're doing in the quality improvement team. We've given you guys an opportunity to experience some of the interventions that are available for our service users, and we've invited James, who's come along to do our session. I'm now going to hand over to Jen Taylor-Watt, one of the QI leads, who's going to lead the panel question.
Thanks very much, Emma. So yeah, as Emma says, I'm one of the QI leads in the QI team, and I'm going to be hosting this session today with members of our leadership team from across the Trust. So if I can invite them to the stage, we have Professor Jonathan Warren and Dr. Paul Galuli, Paul Binfield, Dr. Navina Evans, and Dr. David Bridle. And to introduce them properly, Dr. Navina Evans is our Deputy Chief Executive, Professor Jonathan Warren is our Director of Nursing, Dr. Paul Galuli, Head of Forensic Services, Dr. David Bridle is our Clinical Director for City and Hackney Mental Health, and Paul is our Senior People Participation Lead. Lord Paul Binfield for this session, this time only. Wonderful, thank you. Okay, so for the sake of time today, we have had some questions sent in advance, which we're going to run through. But if you have any questions that you would like answered, you can pose them on Slido via the code we talked about in the beginning. Okay, so first question for the panel. Might be nice to start on a positive note, I think. Jonathan, would you like to reflect on some of the main successes you feel we've had with the QI programme in the first 2 years?
Thanks, Jen. I guess I just want to talk about 2 things, really. Firstly is the individual projects in themselves. As Jason was very eloquently talked about this morning, at the end of graphs, at the end of figures, at the end of celebrations are always patients or our staff. And just seeing some of the work that you guys have been doing around reducing violence, around increasing access, around increasing the physical health of some of our patients, are individuals who are benefiting from that. And I guess that is just fantastic and just makes me smile and feel very humble every time that I see that. Just seeing Caroline Dow's out of the corner of my eye there, the work that they do around pressure ulcers. So there's that graph where you saw the reduction in pressure ulcers at grade 2. They are real people not getting pressure ulcers. Not only are they not suffering, but we are saving money in doing that. And Caroline could give you an exact figure of how much you would save for every grade 2 pressure ulcer. I guess the other thing that's given me great pleasure really has been watching our staff grow and be able to sort of feel that they can make changes in their teams and think about how they can do that. That, of course, has required us to behave differently to allow you to do that, and that's, you know, we're constantly learning about how we can create those environments that allow you guys to thrive and the milieu that allows you to make those changes that are so important to our patients. So I guess they're the two things that I wanted to say, Jen.
Thanks, Jonathan. Okay, maybe perhaps over to the flip side then. We know work like this does come with challenges. So Navina, could you reflect on some of the main challenges you feel we've faced with the work we've been doing on QI over the past 2 years, and also some of our strategies for tackling those challenges?
So this work hasn't been easy, and I think that there have been a number of challenges, and I'll just pick 2 or 3 of them. Initially, when we talked earlier about building the will, and I think a lot of people, myself included, when this work started, just a bit sort of skeptical about it, really. You know, here it is, another initiative. We all talk about improvement. Is this really going to make a difference? Is it going to be something that will, you know, big bang start and then fade away? And I'm really pleased to see that people have put so much effort. It's really caught on. And that's the only way, really, is when, you know, frontline staff think it's worth it. They tell other people about it, and it catches on in that way. So that was a challenge. It still continues to be a challenge, and we're now launching in Bedfordshire and Luton. So there's, you know, we need to make sure that our colleagues there really can be liberated to do this sort of work. The other is that I think increasingly there's a lot more pressure, external pressure. There's sort of all the worries about money in the NHS and you know, incidents and targets and things like that, that we mustn't be derailed by that, because actually some of the answers to those problems are within the sort of quality improvement work that we do. So I've heard a lot of people, when I talk to them, talk about not having enough time. I don't have the answers, and I don't quite know what the solutions are, but I think we need to focus as a sort of whole community, staff and patients and carers, about how we embed this in our day-to-day work so that it doesn't feel like it's another piece of work on top of what we have to do, because it should become part of what we do. Now that, I think, is our next challenge going forward, and that will be our struggle. But I think that there is a way of doing that, and that's what we need to do.
Fantastic, thanks very much. I guess sort of connected to some of those sort of thoughts and ideas. David, you're a clinical director in City and Hackney services. In your role, I suppose you come up against this challenge quite a lot. How do you go about engaging and influencing staff who might be perceiving QI as just the next initiative, just the phase that we're going through?
Yeah, it's certainly something we do encounter. I guess there are 2 bits to my answer to this. One bit is about kind of what I talk about with individuals who have that perspective, and the other is a more general comment about an approach around that. So I really think that the important starting point is to validate that perspective. It's a very realistic perspective, and it's a very understandable perspective. There have been lots of initiatives that come through all of the time, and so it's very valid to think that, is this yet another initiative? And the reality is we don't know what the future holds. I don't know what will come from integrated care organizations or devolution, and how that might potentially derail even very good things that are going on in trusts. So I think it's a valid perspective. However, moving on from that, I think it's really important to link back the principles that are embedded within QI to the values of the individuals. And I think that with the methodology we've got and the way in which it works does very well in terms of aligning with what most of our staff are interested in and what they think is the right way of doing things. And so as an example of that, it would be things like really embedded at the heart of it and at the core of it is really about meaningfully engaging frontline staff to kind of be involved in decision making and influencing the kind of changes that are put in place in their own services, allowing staff to be innovative and come up with new ideas and new ways of doing things, allowing people to do things and for those things not to work out as was hoped, and for that to be fine and to be a good thing. And also being able to kind of have the evidence about what impact the changes are making. So all those kinds of principles that really are at the heart of QI are really kind of valuable kind of links to, I think, the values that most of our staff held. And so I'd link it back in that kind of way to kind of think about we're going to anyway have to have some kind of mechanism of change. And if it's one that kind of aligns with your values and how you see things, then you want to make that kind of mechanism of change work and succeed. So you want to kind of make the most of this rather than going to something different that may not quite align in the same way. On a more general point, I'd say that in reality, we just need to get on and do it and not be unduly influenced or preoccupied with people who are not interested and not engaged with it. So it is about getting on and working with the people who are interested, who are engaged, and in essence working with what we call the so-called early adopters and kind of making the changes, embedding the QI, getting the success from it, and with that, influencing people through seeing what it does, so that the kind of majority follow in light of kind of what they see actually happening. And so our emphasis in City and Hackney is very much about just getting on and doing it, trying to embed it in the different meetings, forums, etc., trying to make sure that where we're thinking about a difficult problem and trying to think about how we're going to tackle it, that QI is part of that thinking. So it really becomes part and parcel and more normal business within what we're doing. And I think it's kind of seeing the impact of it that really will make the difference and have the more powerful influence to get people engaged and interested in kind of working with that.
Thank you. A question we've just had come in, which connects with what we're talking about, so helpful to pick up now, I think. Audience members interested to know, how does the Trust intend to reward their frontline staff, besides their monthly wages, for working so hard to sustain quality despite the ongoing challenges? Anyone got some thoughts on that?
Do you want me to start? I think being part of this work is rewarding in itself. I think a lot of our staff actually gain a huge amount for seeing the improvements they make in patients' lives and the quality of care they deliver. And that in itself is a reward itself.
We were last week talking about reward generally with some of our directors. We'd like to hear more from people, from our staff, about what kind of things helps you to feel appreciated and helps us to feel appreciated as well. And I think reward or recognition is really very important. I'm not sure we do enough with our patients and service users and carers to kind of harness their input and their feedback, which is actually, I think, really rewarding. What I've seen is when people, the number of times I get emails or scanned copies of a card or a letter that somebody has received, and sharing that is really powerful. So I think there are lots and lots of ideas out there. I don't think we do enough about recognition. And so, yeah, that could be something that we should be looking into.
It is a bit ironic, as a trust, we've got a reward and recognition policy that covers all the service user and carer involvement, but it doesn't cover staff. So I think that tells us a great deal.
Thank you. Lots of thoughts there, and a challenge back to us, actually, to come up with some thoughts to share with the leadership team, in fact, to build on what we're already doing. Okay. We've talked about this issue a bit already today with Jason in terms of some of the financial challenges that we're all facing. Paul, perhaps as a leader of forensic services, do you see QI helping with the financial challenges and the financial environment? And if so, how? And I guess as a second point, have you seen any benefits already within forensics from QI in terms of financial?
I kind of said this to the last group, and I'll repeat it here. It is a bit kind of a cultural stereotype that when you come to talk about money, you always come to talk to the Scotsman. So Jason got it this morning, and then I'm getting it the second time in this way round. But actually, having thought about it, actually, I think it's more a compliment than it is an insult, because it's not necessarily we're tight with money, but actually we're canny with money. We spend money very well. And I think that's an important factor that we have to think about at the minute. Where, to be honest, it is an austere time, and it is quite difficult. But there's this assumption, and it's a very simple assumption, that the only way you can improve healthcare is by throwing money at it. And actually, that isn't the case. There are lots of other ways we can improve the quality of care for service users without necessarily adding to the cost. And I think we have to think about that. Jason mentioned this morning about reducing waste. And I think we all know within our own areas of work, there are ways that we could reduce the waste we have. Working more efficiently and looking at how we can work more efficiently is a major way in moving forward and improving quality. QI, for me, gives us a structure that allows us to improve our efficiency and improve our quality of care. It gives us a way of actually benchmarking what service we provide and how we can more efficiently provide that by making changes. So I think for me, QI is really important in how we move forward. I think within forensic, we're still in the early stages. I don't think we've got anything at the minute that I can come to you and I can say, well, we've shown that we've improved financially by doing some of these QI projects. But I think anecdotally, there's a couple of things coming up within forensic that are already starting to perk up my interest. I'm thinking it may be something we want to look into a wee bit more and look into the financial modelling. So you heard a little bit this morning about the QI project in Clerkenwell Ward. Clerkenwell Ward is a low secure learning disability ward for men, and where through QI there's been a violence reduction programme in place which has reduced the violent incidents by 48%. That's quite a massive difference. What we're also seeing in two of our other wards, Westferry Ward, which is our male medium secure intensive care unit, and Shoreditch Ward, which is our male medium secure learning disability unit, we're also seeing different QI projects on violence reduction happening in those wards, and again seeing really good results, different ideas and different kind of a change ideas, but really good results in seeing that violence reduction. The interesting thing that I'm seeing at the same time is our sickness rates in our staff are reducing. My sickness rate at the minute for this month is the lowest sickness rate that we've had in forensic for the past 3 years. So actually, I think there's a possible association there we're having between our violent incidents and staff being off sick, and our violent incidents leading to staff feeling that they don't want to come into work and being off sick as well. So I think we've got some association there where we can start to see that actually improving staff feeling that they're part of something and improving the quality of care on wards make them more eager to come into work, and we're getting less sickness reduction in it. Through that, we've got less bank usage. Through that, we're saving money. So actually, I think there's some stuff there we're starting to look at and financially model, which I think will be quite useful in the future.
Fantastic. Thanks, Paul. Yeah, and I suppose this is one of the key areas where the teams on the ground need to be really supported by our central functions to, do this kind of modelling and analysis. And thankfully, colleagues in finance are hugely supportive, and we're looking at this cost cases across a number of our high priority projects where we can see that there is particularly potential benefit there with QI team supporting. Lovely, thank you. Okay, so I guess the next question is one for Paul. We've talked about service user involvement already today, the fact we've come a long way, we've done well, but actually we've got a bit of a way to go. So yeah, what could you talk about sort of some of our strategies and plans to increase the levels of service user and carer involvement in QI?
Yeah, sure. I mean, I think we have come a long way, but we've got a long way to go with this. So I think if anyone wants to look on the QI microsite, we've put a lot of resource on there around, we've put a job description on there or a role description that anyone who's starting a QI project really needs to think about how they involve a service user and carer and how much time that would be and what the tasks are. And we had a meeting yesterday with the service user and carer steering group around how we advertise those. So it's almost like you're advertising for people to come and work on your QI projects. But also then the reverse can happen, that we're looking at service users and carers who want to fill one of those out and more or less advertise themselves for their skills. This is what I'm good at, and we can match them up to a project like that. I think we've got a couple of areas that we need to think about seriously. I think we need to think about carers' involvement in QI. I think it's something just by the nature of a carer's day, they're often caring, they've often got less time. So we probably need to think a bit smarter and quicker about how we can get carers involved in quality improvement. I also think we all need your help, I think. One of the main things that we're struggling with now is we've got so many service users and carers and patients who get involved in stuff, but we need more. So it's about you guys thinking about the people that you're working with, linking them in with people participation teams, so that then we can support them to get involved. I think we just need to get a critical mass of people who are willing to get involved, who then can support some of the projects. Because some of the difficulties we're having is there's great motivation, enthusiasm from a lot of the projects and the teams, but they're not quite sure about how to do it. So we can support them with that. But what we're finding on our end is that we're sort of using the sort of people that we've got already quite a lot. So we just need to think about how we can get more and more people involved, especially if it's a project in your team. How can I get the people who use my service involved in this project? I think that's the easiest way, and we can support you with that. So I think ultimately we're doing really well, but I think we just need to expand that out now and get more people involved.
Lovely. Thanks, Paul. Navina, I think this one might be one for you. As an organisation that is embracing continuous improvement, what role does QI have in actually helping our staff feel valued and feel joy and happiness in their work?
Okay, I think that this is timely. QI is the right time for us now to be thinking about this, partly because externally things are getting much more difficult in the NHS. There's a lot more pressure, and we see a lot of evidence of people feeling that things are very difficult. So there needs to be hope for us. I'm amazed, really, every day when I meet people that who work in this organisation, who are so dedicated, committed, motivated to work for patients, service users, carers. And that's really at the heart of QI. It's simple, it's common sense. And one of the best things about it, I think, is that it actually talks a lot about looking after staff through QI, but also it talks about, joy at work. And for me, having fun at work is really, really important. I have to go home every day and think I've had quite a lot of fun today, and that is, I'm sorry, but that is how I feel, and I think it's possible. And QI has allowed us to do this, actually, because I think for a long time I used to keep this a secret that I had fun at work, because you feel that, you know, if you say that somehow you're not taking people's suffering seriously, or or the job seriously. But actually it's so important, because if you're not happy and you're not enjoying yourself, then it's really difficult. And this gives us that permission, if you like. It also means that as an organisation we have to think about the culture, and that then means that we have to think about staff well-being, the conditions to make QI work. So whenever we hear about barriers or problems, it's usually something to do with the systems or something to do with the conditions. That means that we have to confront those to release them, otherwise the projects won't work. So, it feels like it's just the right time, really, to take us as an organisation to that other level.
Great, thank you. Some of our questions that have come through from you in the course of the morning. Connected with some of the stuff we've already been talking about, but audience members interested in, back in the day when we got going, did we actually stop doing anything to allow QI work to happen? Did we do anything to carve out that space for people?
We tried to stop doing lots of things. So if you remember, we cut the audit program in half, if memory serves me right. Navina, you ran a competition, didn't you, of what was it called? Remind me? Activity of lower value, and we chose 2 or 3 of those things that we stopped doing. What else did we stop doing? They're the 2 off the top of my head.
I'll tell you what they stopped doing, and I can say this as someone who's not an executive. They stopped issuing orders from the top and started to listen from the bottom. So I think that's the first thing that they stopped doing.
I think one of the things that we asked people to do as well was look in their own teams and services as to what they felt they could stop doing, and I think I'd be quite interested to hear now, after 2 years on, what people have come back with. And I know lots of teams have done different things, and interestingly, somebody suggested we stop doing CPA, but actually when you sat down and thought about it, it actually helped people to think about the value of CPA and how we actually needed to do it better and differently, and so things that were frustrating people, that also enabled them to think about how they could do them better or differently.
Fantastic, thank you. Someone's been reflecting on some of what Jason was saying this morning, and are interested in, are we as a trust actually doing anything to influence policy and politics locally, regionally and nationally around some of these ideas?
Well, I think that Kevin and Omar and our QI team have been very involved. We have been meeting with other organisations, other trusts have come to talk with us, and through the IHI and through the network there, we've done quite a lot of work. Locally, because we're involved in integrated care in all of our local boroughs, we've had an opportunity to bring this work to a wider audience. Our commissioners are very interested in quality improvement, and actually many of our commissioners have also been part of the learning and the training, and probably are here. So there's a lot of ways that we can have taken this and influenced it. So there are many different opportunities. Marie, of course, our chair, takes every opportunity as I can see it, to talk about quality improvement in the wider network. So there are lots of ways in which we can do that.
The other thing Paul and I have been trying to do, Paul and I both work 1 day a week at the CQC as advisors to them. And as we'll find out in June when they visit us, the CQC are a very assurance-based sort of system, and we've been talking to them a lot about how they can think about improvement as well as just assurance in their inspections. We're having limited success, but we keep fighting on that front rather a lot. And just to reinforce some of the stuff that Navina said, that we're having an awful lot of interest from other trusts. So Oxford are coming down to see us next week, spend the afternoon with us. Amar, I know, hosts loads and loads of trusts every month. He has an open day where people come and see some of the work that you guys are doing. So there's a lot of work that we try and do around influencing policy. I think Jason challenged us to do more, and I think that's a fair challenge, really.
Lovely, thank you. Someone had a question about the IHI. We've mentioned the IHI a number of times this morning, but people are interested in actually what is the relationship, what is their involvement in our programme, and sort of how and why and what are the cost implications of that?
I can start. I don't know the cost implications, actually, so I can't answer that bit of the question. Why we chose the IHI? Well, we felt very clearly we needed some external support to deliver the programme. We didn't think we could do what we wanted to do ourselves. So we followed the procurement that we have to go with NHS, and we advertised we wanted a partner. A number of us went to see a number of our colleagues who had done some of the work. So we went to see NHS Scotland, we went to see Tees Esconweir, we went and saw Salford Royal and other organisations that were doing similar work. And I think during the procurement process, we felt the IHI shared our values, really. Again, when you work with the IHI, they talk a lot about patients, putting patients at the heart of what we do, about all work really being around improving patient and patient care. So I guess they really sort of touched our values and what we felt the values of the organisation were. In terms of the role they play with us, so you see them, many of you have done the course with Bob Lloyd and others doing the improving science in action. They also help us as leaders, really, to think about how our behaviour influences our staff and how we can create, as I said earlier, that milieu that allows people to thrive. And they can be very challenging to the likes of Navina and myself and Mason and others in how we behave and our actions and what we pay attention to. So I don't know, Navina or Paul, if anyone wants to add anything to that.
I think we felt it was really important to have external experts who scrutinize what we do, challenge, and also help to keep us on track. And so far, that is exactly what they've done. In terms of the finances, I don't exactly know what the cost of it was, but we were talking earlier about we're now beginning to start to try and put in cost terms what the benefits have been of the work that we're doing in terms of the projects and the programs. And I think in due course, it's a fair challenge that we should be able to lay out what this program has actually cost and what we think the benefits have been, again, in financial terms. I think that's a, I'm not sure, maybe next year we might be able to make an attempt to look at that, because I think 3 or 4 years down the line that should be possible to start.
I think there's two things that IHA have bought. I think Jason talked about it this morning in his talk, was that the NHS traditionally don't promote themselves well around what they're doing. So that gives us an opportunity nationally and internationally to promote this work. I also think what it does, and it links us in with partner organisations, so that we've got our colleagues from Scotland down today. We've got colleagues in Denmark and Kaiser Permanente, who we had the video from. So it's also linking us up with organisations who are doing a similar journey, so we can share what we're doing well, what we're not doing. We can sort of learn from each other's mistakes. So I think that brings a lot of value to the process as well.
Lovely, thank you very much.